Hi, my name is Bertrand Dirk, and today we'll be discussing about what cyclical vomiting syndrome is. So, have you been diagnosed, or may you think you suffer from cyclical vomiting syndrome? Well, today we'll be going into greater detail so that you have a clear understanding of what this condition is, as well as understanding the possible cause and the potential treatment options to help treat cyclical vomiting syndrome. So, what is cyclical vomiting syndrome? It is basically characterized by periods of severe vomiting, followed by periods of symptom-free periods, or we call it periods of remission. Now, while the symptoms may completely disappear throughout remissions, it is possible that they may still linger as more mild symptoms. Now, cyclical vomiting syndrome sufferers will vomit at least 4 times per hour during an attack, while with attacks lasting anywhere from 1 hour or up to 10 days. Now, due to the length of time and intensity of these attacks, it can leave sufferers experiencing severe dehydration. Now, while it is most commonly experienced in children between the ages of 3 and 10, it is also reported in adults. Now, cyclical vomiting syndrome is considered a migraine-like condition, as it has been associated with sensitivities to the central nervous system. So what are the symptoms? The common signs and symptoms are recurrent vomiting lasting up to 1 week, severe nausea, intense sweating. Other features may also present, such as abdominal pain, diarrhea, fever, and even dizziness. Now, as the symptoms are similar to other several conditions, it is often misdiagnosed. Now, while cyclical vomiting syndrome is considered to be a migraine disorder, it is rarely associated with headaches. This is due to attacks including headaches being classified as classic or common migraine. Now, there is another condition called abdominal migraine. So, what is the difference between abdominal migraine and cyclical vomiting syndrome? Now, due to the similarities in symptoms between the both, they are often considered the same condition. However, there are some key differences. Cyclical vomiting syndrome relates to intense bouts of nausea, vomiting, and other stomach-related symptoms lasting up to 10 days. Comparatively, abdominal migraines last up to 3 days. Also, while it is possible for people experiencing abdominal migraines to experience nausea and vomiting, it is most commonly just experienced as abdominal pain around the umbilicus. Now, both conditions can have a loss of appetite and pale skin during an attack. In both cases, sufferers can experience loss of appetite and pale skin during all of these attacks. Now, so what is the cause of cyclical vomiting syndrome? There are many different theories about the cause of this. Some suggest that chemicals such as histamine and serotonin are involved. Other theories include genetic differences or hormonal imbalances. There seems to be a strong link in children who suffer from this condition to developing migraines later in life. Because of this, it is proposed that cyclical vomiting syndrome is a form of migraine. One of the reasons that can be hard to establish a cause is that children have a hard time differentiating between cyclical vomiting syndrome, abdominal migraines, and stomach flus. As such, it is important to rule out any of these differentials, as well as irritable bowel syndrome, gastroenteritis, and appendicitis. It is common for sufferers of cyclical vomiting syndrome to present with no identifiable pathology. In these cases, a sensitized brainstem may be the underlying and the true cause of cyclical vomiting syndrome. Now, modern research suggests that dysfunction in the cervical spine, which is the neck, resulting in a sensitized brainstem, can lead to a wide variety of symptoms. In the cases of cyclical vomiting syndrome, this over-sensitized brainstem will determine low-level inputs, such as eating certain foods, as a threat and trigger to cause a reaction of aggressive vomiting and pain. It is this vicious relaying of information that cyclical vomiting syndrome sufferers experience. Hence, with modern research, the underlying root cause now of cyclical vomiting syndrome is related to the first 3 vertebrae of the neck, whereby the brainstem lies. Now remember, the brainstem houses a nerve called the trigeminal cervical nucleus, and all that information passing from the gut up into the neck goes through the brain, which then interprets that as pain and a threat and can cause cyclical vomiting syndrome symptoms such as severe bouts of vomiting. So then, what can you do if you suffer from this condition? Now, most of our patients who suffer from this condition have already tried a wide range of different treatments. But my main question to ask you, if you suffer from this, is have you had your neck assessed by a headache consultant? More importantly, have you had the first 3 vertebrae assessed? And have you been deemed and proven that the brainstem is the cause of your cyclical vomiting syndrome? Now, if your brainstem has been proven to be hypersensitive and the cause of your condition, then treatment can begin immediately to resolve or reduce your condition. However, if you have not had your neck thoroughly assessed by a headache consultant, nor have you had your brainstem assessed by a headache consultant, then I would urge you to seek a professional to see whether or not your cyclical vomiting syndrome is a result of your neck and the brainstem. So, hopefully from this video you have a better understanding of what cyclical vomiting syndrome is, what the cause is, and the treatment options. If the neck and the brainstem is the cause, then treatment can begin immediately to desensitize the brainstem, basically meaning down-regulating the hypersensitiveness of the brainstem itself. So, my name is Bertrand Dirk. I hope you have found value in this video. If you have any further questions, feel free to comment below or contact us through our channels provided below here. Thank you for listening to this video, and I look forward to seeing you in another video.